MMT Wrist flexion, flexor carpi radialis and flexor carpi ulnaris. Assist the patient to the short sitting position with the feet resting on the floor or on a stool. The forearm is rested on a table in supination. The wrist should be in a neutral position or slightly extended. Stand in front of the patient. Passively flex the patient's wrist. Stabilize the forearm and with the other hand, bring the patient's hand up to the ceiling. You are not assessing the infield, you are determining how much range the patient is able to move the elbow in this direction so that you can appropriately assign a muscle grade. In patient-appropriate language, ask the patient to flex the wrist. Stabilize the patient at the forearm. Please note that it is not necessary to have the patient perform the active motion twice if no substitutions are observed on the first attempt. You may apply the resistance at that point. Common substitutions include ulnar or radial deviation and using the finger flexors to assist the motion. Make sure the patient's fingers and thumb are relaxed. After correcting any substitutions, ask the patient to perform the motion as previously. Stabilize the patient at the forearm. With your other hand, apply resistance to the palm of the hand. Your thumb should be around the posterior surface of the hand. The resistance is applied in a downward direction into wrist extension. Apply the force for a 5-second count. Grade 5, normal. The patient completes full range of motion in wrist flexion and holds against strong resistance. Grade 4, good. The patient completes full range of motion in wrist flexion but breaks against strong to moderate resistance. Grade 3, fair. The patient completes full range of motion in wrist flexion but does not tolerate any resistance. If these conditions are not met, the patient must be repositioned to a gravity-eliminated position. Keep the patient in short sitting with the feet resting on the floor or on a stool. The arm continues to be supported on the table. This time the forearm will be positioned so the hand rests on the ulnar side. The gravity-eliminated position of the therapist is to stand at the test side of the patient, supporting the arm proximal to the wrist. Instruct the patient to flex the wrist, maintaining the fingers relaxed. Grade 2, poor. The patient completes full range of motion of wrist flexion. For Grade 1, reposition the patient as for Grade 3 and support the wrist in slight flexion. You must now palpate the flexor carpi radialis on the lateral palmar aspect of the wrist, lateral to the palmaris longus. Palpate the flexor carpi ulnaris on the medial palmar aspect of the wrist. Instruct the patient to attempt to flex the wrist. Grade 1, trace. Palpable contractile activity at one or both tendons with no motion. Grade 0, no palpable contraction.